Hey guys, how's it going? I want to quickly discuss about bladder obstruction due to prostate enlargement. Believe it or not, it really does happen in a lot of elderly people. They try to pee, wouldn't come out. They try again, it wouldn't come out. And then finally they make this difficult choice of having to go to the emergency room to see what the heck is going on. And then in the emergency room, when they scan the bladder, it may show a lot of urine in there. And then they wouldn't be able to just pee. It's because the prostate is enlarged and it just obstructed them. A lot of times there's just enough warnings that's been given to the patient, several months or years ahead of time. They have urinary hesitancy. When they go to pee, the urine wouldn't come out right away in the toilet and they have to wait for a couple of minutes. So that's a sign. Many times they're dribbling. Many times the stream of urine is very thin. It's not thick like what it used to be for them. So if they keep ignoring all these symptoms, then finally it ends up culminating in an emergency room visit because now the pee is completely blocked. And then I'll tell you what happens once they're in the emergency room. Bladder scan shows that there's a lot of urine in there, and then they put a catheter and leave it in there. Okay? And then they start these patients on medications to relax the muscles in the prostate, like tamsulosin. And then if there is any signs and symptom of a urine infection, which frequently goes hand in hand with this problem, then they give them antibiotics for the urine infection. And many times they just discharge the patient to their home with the catheter in. And then these patients have to learn how to live with the catheter. So the bag, has to be tied to the thigh. And then, so it is there hidden. And then the catheter would be emptying into the bladder. And these patients can go to the church, they can go to Walmart shopping and all of it. And then in the night, they can, just hang the bag by the side of their bed so that the urine drains into it by gravity. Then a couple of weeks later, when they go to the urology clinic, many of the time the problem has been now solved because prostate medications have been working now for a few weeks. So when the urologist, puts like half a liter of a normal saline or something in the bladder, and when they take the catheter out and when they ask the patient to pee, the patient is now able to pee. So that's good news. But sometimes, they are still now not able to pee, and then the urologists have to put the catheter back in and then send them back home with the catheter again inside. And then they make further follow-up visits, during which time they will analyze the bladder strength, the thickness of the prostate, how enlarged it is, and then they'll make further decision whether to do prostate surgery or not. I hope this helps, okay? Don't let prostate problem get that bad where it goes into full obstruction, okay? Talk to you later in my next post. Goodbye.